My wife and I were introduced to St Wilfrid's Hospice when she was diagnosed with motor neuron disease 3 years ago. The OTs really were one of the saving graces for me, because I nursed her at home. She passed away. I thanked the hospice, and then I was offered a food cookery course, which was done by one of the OTs. OTs really are people who help you get back into a normal way of life.
The hospice is all about supporting people to live well, despite the things that are going on in their life, and that's exactly what occupational therapy is all about, supporting people to live their lives the way they want to live their lives.
Is that it supports people to kind of have well-being throughout their lives. So sometimes having a palliative diagnosis can be quite scary, and it can affect people physically, and enabling them to do the things that are meaningful to them and that provide them with kind of happiness and joy in their lives, and being able to do that with people is what it means to me.
I love OTs. They facilitate the patient's experience in ways that words can't even describe. They make such an impact on a day-to-day basis and create a lovely warm atmosphere here at the hospice.
Occupational therapists help people to maintain their independence in activities that are important to them. So that could be washing and dressing, managing the stairs, gardening, or going back to work. It's all about what's important and meaningful to that individual.
Occupational therapists are very good at focusing on the strengths that people have, building on those strengths, and finding creative ways to help people to do the things that they want to do, the small everyday things that are so important. And I think that makes a big difference for patients and for their carers.
I interact with the OTs every single day. They've encouraged you to do as much as you can, and then just that little bit more. Just when you think you've probably done as much as you can, they just, well, do a couple more exercises or do a little bit of balance or whatever. And almost without knowing it, you find that your balance is getting better, or you're getting a bit stronger or whatever. But what also I like about them is the fact that they're perfectly normal, human, approachable people. I have utmost respect for them.
I'm the family support coordinator here, and part of that role is that I coordinate the adult bereavement services. Very often we refer into some of the groups run by the hospice under the direction of occupational therapy. It reduces social isolation and reintroduces purpose and meaning into people's lives once they've been bereaved.
When we're up against really difficult problems in the home situation where people are desperate to be at home and we just feel that maybe there's no way, and then suddenly, boom, the occupational therapy team come in and they really start to resolve that problem. Great members of the team, lots of energy, fantastic innovation, ideas galore, really just superb.
I was introduced to the occupational therapist through my bereavement counsellor. I'm connected to St Wilfrid's through my wife, who came here in the later stages of her life. And the occupational therapist here on the men cooking group I find absolutely wonderful.
I recommend it to anybody.
The importance of normal stuff. So lots of our patients' lives are very complicated, they've got lots going on for them. They go to hospital appointments, they come here to the hospice, and then the nuts and bolts of daily living can sometimes be a bit overlooked or can be really difficult to engage with. So simple things, getting washed, getting dressed, being able to cook yourself a meal, being able to do stuff for yourself is what OT is all about. And for me, being able to visit people in their home and to support them to do the things that they want to do, however small or however big, it doesn't really matter. So if something is important to someone and they want to be able to do it again, that's very much where we get involved, and we try and enable them to do it for themselves.
The OTs have been marvellous to me. We are a fabulous group of people.
I love OTs.
I love OTs, they're brilliant.
Jennie.